Here's Martha.
Hello. Thank you for coming to this special meeting today of the COC board. It is 3:01 p.m. At 10:20. It's on October 24th, 2024. Sorry, I thought you were signaling to me there. I apologize. But it's 3:01 p.m. and we're thank you for being here. I'm going to start us out with the theory of change and a land acknowledgement. If we create a homelessness response system that centers people who've lived experience of homelessness, then we will be able to meet the needs and eliminate inequities in order to end homelessness for all. And land acknowledgement is the King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the First Peoples of Seattle, the Duwamish people. And this acknowledgement only becomes meaningful when combined with accountable relationships and informed action, as it is the first step in honoring the land that we today sit on and their people. Thank you. Can we do a roll call, Alex?
Yes, we can. Please say here if you're here. Trisha, Sam.
Here.
Tamara Bauman.
Here.
Zsa Floyd. Bella Irons. Amaya Lenore. Dorsal Plants.
Here.
Ruby Romero.
Here.
Martha Sassarosi.
Here.
Christina Sawicki. Victor Liu.
Present.
Amy Thomas.
Here.
TT White.
Present.
Elizabeth Moppin.
Here.
Awesome. With 9 board members present and 4 absent, quorum is met.
Okay, thank you for that. All right, so today is a special meeting where we're focusing on the collaborative application or consolidated application, excuse me. Are we doing public comment today as well? Great. Is there anyone here for public comment? Just please raise your hand and we will call on you in the order we receive them. If there's anybody here for public comment today, speak now or forever hold your peace. Last time, public comment, going once. All right, cool. The public comment is closed. We always do have alternative ways of getting your public comment to the board at coc.questions, right, at kcrha.org. Cool, thank you. So yeah, moving back into the meeting, Dorsal, did you want to take over on this section of the agenda, or would you? I'm sorry that we didn't check in on that.
I think at this point, we're at the point where we're getting to introduce Kelsey, which I'm very happy and privileged to have the opportunity to do. There's a significant amount of work that went into the development of the NOFO and each of the providers who completed applications and each of the raters who put in a significant amount of time and brain power to develop this product. And I think we have something here to be really proud of, and I'm happy to turn it over to Kelsey to hear more about it.
Thank you so much, Dorsal. I'm going to share my screen with everyone. I am Kelsey Beckmeyer, she, her pronouns. I'm a program performance manager with KCRHA and have been helping shepherd our NOFO process through for the war. This is the 3rd year of doing it. Here to present to the COC board our collaborative application. This is what we will be submitting to HUD. Let me figure out what's going on with my computer because the full screen isn't showing up. So I might just have to do it not full screen and make this a little bit bigger. Are folks able to see the
Yes.
doc? Okay, fabulous. So want to go over kind of a high level, just recap of the NOFO process, everything that goes into it, and then talk about the collaborative application, aka the consolidated application, what it is, an overview of the various topics in the application, and then I have kind of a highlighting areas where we are hoping that we are submitting stronger responses this year. And then want to hold time for all of you for if you have any additional questions that you want to go over. So I will dive right in. Gotta click on them because they're not going to move forward for you, Kelsey. So again, we're going to do a high level overview of the NOFO, going over the process that we had to work on the collaborative application, an overview of the topics, our hopeful improvements, and then questions and answers that you all may have. So the COC Notice of Funding Opportunity, or the NOFO, is historically an annual competition where the COC renews current funding and applies for new funding. This year, we've had some changes as the NOFO is moving to a biannual process, meaning the collaborative application, so the big narrative we are submitting, we are going to submit it and that will cover 2024 and 2025. So we will next year only submit one thing, and that will be a priority list for any potentially new projects that there may be funding for, and if we have projects that were not renewed this cycle that need to be renewed next cycle. The timeline is fast. So this year was July 26th through October 30th. This is very quick for a grant renewal cycle. It moves very quickly, and as Dorsal kind of put at the beginning, this would not have been completed or kind of as strong as I think it is this year without the work and input from all of our COC providers, from our external partners, from the raters and rankers who put in an exceptional amount of time working on this to support the priority list, and just very much want to give kudos and thanks to everyone who contributed to this. This year, KCRHA, as the COC lead and collaborative applicant, submits two things. One is the priority list. This is what was reviewed October 2nd. And the second one is the collaborative application. A recap of the dates for the NOFO. So our local competition to put together the priority list. This was opened August 12th. August 30th is when all of the applications were submitted. There were 75, I want to say, individual applications that were submitted and reviewed by raters between September 4th and September 23rd. October 2nd is when we presented to the COC board the review and vote on the priority listing. So how we are going to submit in a rank order the projects we want to renew and seek additional and new funding for. This needed to be posted publicly by October 15th. And today, October 24th, we have the special meeting to vote on the consolidated application. This must be posted publicly and approved 2 days before the NOFO is due. So that is October 28th. And the NOFO official due date is October 30th. The collaborative application is the overall grant application of how our system is performing. So HUD wants to know, what have we done the last year connected to a number of different areas that I'll get to in a moment. In order to provide really robust answers to the questions that HUD poses to us, KCRHA worked with a number of external partners to have as thorough of responses as possible. And I just want to highlight and extend gratitude to some of those partners. Our NOFO planning work group, who was meeting weekly and bi-weekly throughout most of this year. The City of Seattle, King County, Healthcare for the Homeless Network, the Seattle-King County Coalition on Ending Homelessness, the Mayor's Office on Domestic Violence and Sexual Assault, the Coalition on Ending Gender-Based Violence, the Workforce Development Board, Seattle Housing Authority, and King County Housing Authority. All of these partners provided insights, work that they are doing, updates on how they are collaborating within our system, just to really make our answers super solid. So just a deep thanks to all of our collaborators. A little bit of the process of how we developed the collaborative application. So KCRHA staff worked internally on a shared spreadsheet that has all of the questions and the detailed guidance from HUD to ensure that we are answering clearly what HUD is asking. They have not just the questions, but how they kind of want you to respond. So a little bit more detail of what they're looking for in your response to those questions. We sent question sets to external partners for input. We included as well in our ask our responses from fiscal year 22 and fiscal year 23 for a comparison and an idea of what we were looking for. We also held some NOFO planning work group working sessions where we sought input directly from board members and others are part of our NOFO working group. Once the kind of input and details was gathered from all the parties, we had lead staff at KCRHA draft responses for each of those questions. Once we had draft responses, those were reviewed by 2 others for clarity as well as character count. There's very particular character counts. So on some responses, you may see that a word is abbreviated in an odd way, or the spacing might look a little funny, we're missing some periods somewhere, and that's all to ensure that we can get the content in the question. So there's some a little bit of an art with making sure we meet the character counts. The topics that are in the collaborative application, and this is just kind of a broad overview of those topics. So when I wrap up, if there are areas folks want to dig into a little more, welcome to do that. But the topics that we address in the collaborative application, one is around coordination and engagement on a federal, state, and local level. And some of those different topics include our COC membership and community stakeholders, engaging racially diverse persons and organizations, connecting with Emergency Solutions Grant direct recipients and program operators. The direct recipients of the ESG grant are King County and City of Seattle. So how do we coordinate with those partners? Our connections with the education sector, health sector, domestic violence sector, our public housing authorities, and kind of broadly other systems of care. The next kind of major area that we address is system performance. And that's related to the number of people who are entering homelessness for the first time, our street outreach approaches, our coordinated entry system, the bed coverage in our continuum, both geographically, as well as who is participating in our HMIS, our homelessness management information system. our performance related to accessing mainstream benefits and income, how we are working to address racial disparities, involving and having active participation with folks who have lived and living experience and are experts. And then they also look at our NOFO local competition process. Finally, we look at information around our homelessness management information system. We provide information around who our vendor is, the geographic range and coverage of HMIS and who's using it, participation in our housing inventory count, our point in time count, and a comparable database for victim service providers. There's then a final section for the DV bonus in particular. This is quite a hefty section. They really want to know about our experience as not just a continuum, but as applicants and providers, experience and plans to implement any new projects. The areas where we are hoping to see improvements from our kind of performance and score from the prior year include our rapid rehousing count and bed coverage rate. The number of those engaged in rapid rehousing decreased from 22 to 23. This year we did see an increase, so we anticipate an improvement there. Our partnerships with public health, the local competition process. Last year at the initial competition, the original due date, we had about $1 million that was unrequested. So in order to put forth as many projects as possible, we reopened the competition. And that was a risk. And we saw some kind of score go down because we didn't meet particular deadlines that HUD set. Our street outreach strategy, we're hoping to see an improvement on, as well as our strategies to support families and youth, reduce length of time of homelessness, improve exits and retention of permanent housing, and increase income. I put the particular question numbers here as well, as those are the specific questions that we are hoping the information and the content that we are sharing this year will provide a stronger response and hopefully a higher score from HUD. Our final steps include today, the meeting with all of you to review the consolidated application and hopefully have approval. From there, we will finalize the application in eSnaps, which is the grant portal with HUD. We need to publicly post the consolidated application that is approved on our website and then communicate that broadly. I have to then get screenshots and add those into the application before I can hit submit before the due date on October 30th. So I want to kind of take some time to see if there are questions that you all have.
Hi, Kelsey. Thanks so much for giving us that overview. I also saw Dorsal come off mute, so I'm going to hand the floor over in case they have any questions, but I just wanted to say thank you for that.
I was also going to say thank you and maybe suggest if we could, Alex or Kelsey, maybe stop sharing the screen so we can see everyone's lovely faces or black screens, which I am guilty of today, I will acknowledge.
Great. And Elizabeth, I see your hand.
Yes, I was wondering, were there any things this time around that were particularly surprising or things that you want to flag that we should pay more attention to next time?
That is a great question. So I think my brain is a little too muddled in NOFO right now to have a strong answer. But what I am planning is to do a debrief. So give me like a week and a half to get my brain a little less in it. But I have a document that I've used the last couple of years to walk through all of the questions and kind of reflect back on the process to look at where were areas that were challenges, what are stated commitments, what are requirements, and what do we want to take note of and be paying attention to in the coming year to ensure we capture really well. So I have that put together, and then the next kind of step is to also do a debrief and develop a work plan in conjunction with the chairs of this board, the System Performance Committee, the Coordinated Energy Committee, as well as the Youth Action Board, to have a kind of developed and cohesive plan for 2025 that will speak to some of the things that we are noting in your question, Elizabeth. One thing that does come to mind in our answers regarding coordination with public health, HUD wants to know about what were initiatives or other actions that we've taken to support education and outreach around various public health topics. And this year we were able to speak to efforts around the opioid epidemic and some kind of learning groups. So we have a note to really ensure that over the course of 2025, not that we are just engaging in things, but really taking notes and thinking proactively about what are some public health trends or issues that we are seeing so that we can be a little more, I think, just like ahead of it in terms of coordination, collaboration with providers, in terms of getting information out, and what can we as a continuum be doing to not be reactive, but proactive. So that's one area that I know is on the kind of front ends. The other piece that kind of comes to mind for this is we'll know a little bit more about the how once we get the HUD announcement. So one thing that is in the DB bonus section is HUD wanted us to really outline plans to implement new DB projects. And this would be DB rapid rehousing projects. So wanting to ensure that we are really putting in some thought and care in preparing new providers to start up new projects. And we've kind of been doing some work to put in place trainings with our local HUD office, just to ensure that there's really kind of robust onboarding and support for new providers, especially if they haven't done kind of COC or federal grant work and understanding the particularities there. So there's a little bit more kind of care and attention to making sure new programs and new providers have you know, a more focused startup support.
I have one observation from my work as a rater, and that was because I happen to have a number of applications that were under the same umbrella organization. They answered the questions for the organization as a whole, not for the particular applicant. And I found that made it difficult for me to rate. Is there some way that we can tell them we really want to hear about the individual applicant, not just repeated pro forma stuff?
Yes. So we will be kind of revamping anew with the NOFO planning work group. And that will be work that group does, looking at the rating criteria as well as the local application and what's in there. So would welcome you to be a part of that process
and bring those observations. I think those are really wonderful and important pieces from the rater perspective to ensure that, you know, what is being submitted is what is most valuable.
Thank you.
Yeah, and I just wanted to flag in the chat here, we got Jaja as in the attendees, I believe, in case Jaja wants to engage in this conversation at all. And maybe we, I don't know if we have time to maybe walk through just a couple of the questions, like in the answers, and kind of so we can give a good feeling on what was, yeah, said in the application. Thank you.
Definitely. Catherine, are you able to promote? Alex had to step out, so Catherine is going to promote Jaja in. Yeah, I am happy to pull up the application itself. Oh, I'm going to just hop over to Alex's computer really quickly so I can promote Jaja.
Yeah, I was trying to, and it didn't work. Thank you, Kelsey.
No problem. We just have to learn how to use a Mac.
That is a foreign language to me too. It's okay.
Yeah. Oh my goodness, what is going on? Oh no. Let me go grab her. Yeah. We will get it going. Jaja, pardon us. I don't know why I'm not able to click on it, but we are working to get Alex to get it figured out. Here we go. Your computer doesn't like my fingers.
Oh, are we doing the vote?
No, we just wanted to promote Jaja to
Oh, yeah.
panelists because she was in the participants or the audience. Yes.
All right, Jaja, we're moving you over now.
Thank you.
Thanks, Alex.
Yeah. But yeah, let me share my screen again and I can pull up the application itself. This was sent out to all of you last week. So please let me know if there's any kind of particular sections or questions that you want to look at. Yes, Tamara.
Yeah, I saw like the slide that mentioned something about strategies to reduce homelessness. I'm
Yeah.
curious about what was discussed and what strategies we're hoping to increase, you know, or conduct over time. Because I personally always have a problem reconciling the structural conditions of communities versus like practical strategies that we can do. So how did that conversation go?
Yep. Let me pull up those questions. I'm not sharing my screen just so I can not make people dizzy with scrolling. But those are questions 2C1 and 2C2. So let me get to those and I can pull up that narrative. But this we coordinated and got additional information, not just from KCRHA and NOFO Planning, but we also reached out to the city and the county as well as public housing authorities on efforts that they're all doing. I am still getting to the correct page because this is a long document. Okay, here we go. Let me share. So the question is reducing the number of first-time homeless, risk factors the COC uses. So HUD wants us to describe how we determined risk factors to identify folks experiencing first-time homelessness, strategies to address it, and then the organization overseeing the COC strategy. So the primary pieces of data that we use is really looking at HMIS data, by name list for veterans and AIAN and incarcerated individuals with competency determinations. HMIS is like our biggest data source. So that's really a huge way we do this. Here our COC was also part of a longitudinal study with Westat that examined risk factors in order to kind of identify if we can predict folks who may be at risk of first-time homelessness. The other big thing that we looked at was prevention programs. So Mary's Place and the United Way have been involved in a prevention kind of pilot and research project with some other organizations across the US. So we kind of also brought in some information that Mary's Place has on their research-based prevention screening tools to kind of improve prevention and implement some changes. Some of those changes that have happened that Mary's Place has really worked to pilot is not capping prevention assistance and working to pay tenants directly if there are landlords who don't accept direct payment. So those were some of the things that we did to determine risk factors and some of the strategies. There's also the centralized family intake line and a family center that is also operated by Mary's Place. They're one of our biggest prevention providers in the continuum, along with United Way. So really wanted to uplift the work that they are doing. We also have work that is being done with schools and McKinney-Vento liaisons, as well as our DV coalition to identify households who may be at risk. So those were some of the other kind of strategies that we wanted to elevate within our response. And the next question that you also had was the other area that we looked at in terms of first-time homelessness is the impact of displaced persons. So we really talked about the impact of asylum seekers. We saw a huge increase, and we kind of noted that our continuum, King County, was highlighted in the press for asylee and migrant arrivals this year, and the impact on first-time homelessness due to the influx of folks in those crises. So we kind of highlighted the church in Tukwila that was supporting asylee seekers and refugees, and efforts to pay for hotel rooms, knowing that, you know, so many efforts don't always meet the full need, but wanted to highlight what was happening. Another piece that we indicated on impacts on first-time homelessness, we saw our regional access points that were reporting receiving an additional 15 to 40 calls per week, depending upon their location. Our southern regional access points really that are run by multi-service center in the YWCA, we're seeing quite an increase in assistance calls because there was an increase from refugees and asylee seekers in the South County. And this, you know, was a huge impact on our continuum of care. So we wanted to also highlight that, you know, there is an impact on folks who have been displaced and are seeking safety and support, and that has been seen and felt in our community.
Thank you for that. And not to take up more time, but curious about and following up from last year's NOFO, what strategies in terms of displacement, like are we talking about displacement in terms of folks who have been displaced by sweeps and encampment closures?
So the question that HUD has is pretty narrow. So they want to know around displacement based on natural disasters or recent arrival into our geographic area. So their view is pretty narrow. So we speak pretty clearly to what HUD is wanting us to address. So that's what we have addressed in the application itself.
Yeah, thank you. Is there any other questions on the application? Okay, going twice, going 3 times. Does everybody feel comfortable moving into a vote on this if there's no objections? Not hearing any, I believe we can move into the vote. Correct? All right. Yeah, so let's go into a vote on the consolidated application for the fiscal year 2024 NOFO, Notice of Funding Opportunity. Oh, Austin, I see your hand.
My mouse
Dorsey.
just died on me as my hand went up. But hello, just need to remind, we need a motion in a second, I believe.
Great, thank you. Do I hear anybody entertaining the motion?
So moved.
Okay. I
Thank you,
said,
John. Thank you, Tamara. Okay, so moving into discussion on this, I believe we did that portion, but if anybody has any discussion on the consolidated application for 2024, the Notice of Funding Opportunity, not hearing any. Now we can move into a roll call vote. Thanks, Alex. And thanks, Austin, for that. I appreciate it.
Just to double check, was it Jaja and Tamara that motioned?
Yes, it was Jaja who motioned it and Tamara who seconded it.
Thank you. Okay, please state your vote when I call your name. Patricia Sam,
Yay. Approve.
Tamara Bauman,
approve.
Jaja Floyd,
Approve.
Bella Irons. Sorry, okay. Amaya Lenore. Dorsal Plants,
Approve.
Ruby Romero,
Aye.
Martha Sasarosi,
Approve.
Christina Sawicki. Double checking that she Victor Liu,
Approve.
Amy Thomas,
Approve.
TT White,
Approve.
Elizabeth Moffin.
Approve.
Great, motion is passed to approve the NOFO Collaborative Application with 10
Yeah.
approvals.
10 approvals. Cool. All right. Congratulations. The NOFO process for our end is complete. Now it's all in Kelsey's hands, right?
Yep.
Thank
I
you
will
so much.
be-
For,
We'll
Sorry.
wrap it up, get it posted on our website, screenshots done, sending it out, screenshotting that. We upload those. I'll hit submit.
all right.
Thank
Well,
you
that sounds
all.
great. Yeah,
I
thank
have
you, Kelsey.
Question, not related to approving this NOFO, but this concept of displacement. Is there any chance that HUD will at some point look at displacement by economic forces?
That is a wonderful question. And what I have seen, if enough continuums are raising those questions, they may be considered by HUD and brought into the application. So for example, we saw in fiscal year 22, for the first time in the collaborative application, HUD asked about COCs addressing anti-discrimination and LGBTQ access to resources. So I would think with enough communities raising those issues and concerns of, we want you to care about this and the work that's happening, we may see that included.
Thank you.
Yeah, Dorsal.
So, kind of tagging in on that question, because I really want to reinforce Elizabeth's thought there, especially because there's such a heavy government component potentially to some of that. How do how do COC boards know that other COC boards have these issue, like, are having these, because obviously we could look at like other applications or things like that, but are there opportunities between COC boards? Maybe this question's an offline or a future answer question, but like, how do we know if, say, a COC board in California is asking the same question as Elizabeth, so that we can actually network and tell HUD, like, multiple COC organizations have the same question about economic displacement being a factor? Yeah.
Yep. So one great way to do that, there is a COC peer sharing roundtable call. This has largely been with COC lead organizations, but I would definitely welcome for COC board members to participate in those calls. I don't know when the next one is. The last one that I know happened was in August, so I think it's been a pause during NOFO season. But as soon as I hear about another one happening, a woman named Amanda from Detroit organizes them. So we'll definitely get that link shared out, because that is a space where some of that sharing happens. It's used to share kind of what are some like policies that different COCs have, or approaches to different things. An example that I can share is our ombuds office presented at, I think it was the August call, that our ombuds office presented about the work that they're doing with other COCs to create ombuds offices for folks experiencing homelessness. So we'll make sure that that information gets shared out.
Thank you.
Great. Are there any other questions for Kelsey or about the NOFO process? I don't think so. Great. So I think we're complete then. We get 15 or 16 minutes back to your day. Is there any objections to adjourning the meeting?
So move to adjourn.
Thank you.
I
Shazia.
second that.
Thank you, Bella.
But I can't leave before I tell Kelsey we love her earrings.
Great earring. Yeah. Well, thank you guys so much for being here today. I'm glad we were able to accomplish this big milestone in our yearly plan. And I look forward to seeing everyone in 2 weeks on Wednesday, November 6th from 2 to 4 p.m. Thank you. Have a great day.
Thanks, everybody.
Thank you.
Thank you all.
Thank you all. Have a good weekend.
Bye, TT. Bye, TT. Bye, Elizabeth.